Payment Program, the Notification of Interest webinar, and we're happy to announce that our state partners, both from OMH and OASIS, have joined us to provide this presentation to you. My name is Boris Kilgoran. I'm with McSilver and McTac, and I'll be actually doing the least amount of talking. So just kind of some of the usual housekeeping rules, just quickly to make sure everybody's aware. This presentation is being recorded. Both the presentation and the recording will be available on the McTac website. We also, as we always do, encourage folks to chat in those the questions throughout the presentation. You know, depending on the time allotment, we'll try to get to as many of those questions at the end. The questions that we can get to, we'll be definitely sharing with the state partners, and we'll try to get those answers as soon as possible. So again, just to quickly repeat, we are recording this presentation. Both the presentation and the recording will be available on the McTac website, and please chat those questions in throughout the presentation. And without the further ado, I'll turn this over to our state partners who will start the presentation. Thank you. Okay, Tricia, you might be on mute.
Oh. Yeah,
there you go. Yep.
Great, I'll do it a lot slower.
We're good. You can hear us now?
We can hear you now. Yep, now you're live.
Oh, great. Yeah. Good afternoon, everyone. Today you'll be hearing from myself, Sarah Krassenbaum from OASIS, and Trish Parazelli from OMH. First, we're just going to briefly give you a Vbp Readiness Program overview. Since the main construct for the program is to create a BHCC, we'll be talking about what creates a BHCC. Trish will be kind of giving you an orientation about how to submit and the specifics around notification of interest form. And then very briefly, we'll talk about what to expect in the application. So as you may already know, the Vbp Readiness Program is funding for community-based behavioral health providers to form a behavioral health care collaborative. This is intended to enhance community behavioral health providers' readiness to help create an inner network and be prepared for value-based payment arrangements. So before you work on your notification of interest, first think about what you want your BHCC to look like. We're hoping that BHCCs will be offering a full continuum of OMH and OASIS services available in the region, and that includes peers and Ccbhcs. The larger BHCCs will be more likely to achieve economic scale in purchasing, for example, an IT system. So the larger your BHCC is, the more advantages you have in that area. One thing we definitely want you to think about is thinking about what your community's needs are in your region. Are there certain communities that are having difficult time engaging in integrated health care that your BHCC can help provide? We've received a lot of questions around local government units. We'll ask you to please consult with your county leadership to determine the appropriate level of participation. They will have a much stronger idea than we would per county. So you can be involved in a BHCC in 3 ways. You can either be a lead agency, a network provider, or an affiliated provider. Not surprisingly, the lead agency shares a great deal of responsibility. They have to be a non-hospital, community-based organization. So that means they need to be a licensed Article 31 or 32, or they can also be a designated provider of BHHCBS. You also, as a lead agency, need to have a contract with one of the participating Medicaid managed care organizations. And most importantly, the agency should already have the infrastructure to receive and distribute funds. As I mentioned before, there are a lot of responsibilities that the lead agency needs to consider. They will be responsible for receiving and distributing funds to the network providers and possible contractors that they may sign on. They are also in charge of coordinating communication amongst the BHCC providers. And so that means throughout your entire network. It doesn't mean that you'll be doing it yourself, but you will be ultimately responsible. They will be also acting as the liaison between the BHCC and the MCO. And then finally, they will be responsible for submitting deliverables to the contracted MCO. Next is network providers. Network providers also must be a non-hospital, community-based organization. So again, they need to be a Medicaid managed care provider licensed under Article 31 or 32, and similar to lead agencies, or they could also be a designated BHCBS provider. They will not be distributing funds, but they may receive funds through the lead agency. That should say through. And finally, affiliated providers. Our guidelines for affiliated providers you'll find are much broader. You could be a PPS, a health home, a hospital, or an Article 28 licensed provider. You could be a state-run program or other physical health providers, or even a non-Medicaid community programs. One thing to be aware of, through this program, an affiliated provider will not receive funds directly. But if the BHCC chooses to, or through the lead agency, they may contract with another one of the affiliated providers for arrangements such as analytics or data management or other functions that possibly the lead agency may not be able to do themselves.
So we're going to talk a little bit about what you're going to be submitting as part of the notification of interest. You can find the notification of interest on our webpage at this link. And something important to note here, even though we said that the notifications of interest would be due on June 5th, we have extended that date to Friday, June 16th. So you've got a little bit of extra time to work on those notifications of interest, but they must be submitted by Friday, June 16th. So we're going to look at our webpage where you can find the notification of interest, value-based payment readiness for behavioral health providers page at OMH. Click the link for the notification of interest. There's a letter to you, the provider, explaining the program. And here is the notification of interest form. This is what you'll be filling out and submitting to us as your notification to us that you want to participate in the program. For your lead agency, we need the agency name, the contact person, their email address, phone number, and then the tax ID for your agency. If you are a IPA with a contract with a participating managed care plan, the IPA may serve as the lead agency. Just provide this information for the IPA in that case. So there were a few questions we're asking of you. We'd like to know, do you have a contract with a participating managed care organization? What regions your BHCC will be covering? We'd like to know who the members of your BHCC are. And then if you currently have letters of intent from providers that are going to participate in your network to participate, we'd like you to submit them. They're not required at this time. However, during the application process, we will be requiring letters of intent from every network provider in the BHCC. So as part of this document that's posted online, there is a template for you to fill out to submit number 4, the members of the BHCC. So if you click over here, this Excel document, open that. It's going to show you how to submit the list of providers in your network. There's a definition here for the lead agency, network provider, affiliated provider. On the network providers tab, in the green line, you're going to submit the information for your lead agency. For all of the other agencies that qualify as a network provider, list them below. agency name, MMIS ID, tax ID, the counties served, which behavioral health services the provider delivers, and if known, how many Medicaid managed care enrollees your program serves. If you're submitting a letter of intent for this provider, just indicate it in the field here that says LOI-Y/N. You can put yes or no. For affiliated providers, if you know them, what we're asking is that you give us the organization name, the tax ID, the counties served, what services they provide, and if they know, if they're currently serving any Medicaid managed care enrollees, you would indicate it here. And then, do you have a letter of intent from that provider to participate in your network? So we're anticipating that when you submit your notification of interest to us, it's going to include this Excel spreadsheet filled out with the providers that you know of at this point, and it's going to include this form filled out, questions 1 through 3 filled out. You'll have attached number 4 and number 5 that are letters of intent from the providers that you know will be in your BHCC. If you're unclear on which counties are in each RPC region, we've also attached this document, which lists which counties belong to which RPC region. So you'll be able to find out which RPC regions you're serving based on the counties that are served by the providers in your BHCC. So returning to the PowerPoint presentation. Things that you should know about the notification of interest. It is required for a BHCC that is intending to apply to the program. You must submit the notification of interest. It should only be submitted by the lead agency in your BHCC. A BHCC is not a single provider, so we do not anticipate approving any BHCCs that are submitting an application from one provider. Agencies can continue to join the BHCC's network after the notification of interest is submitted. So at the time when you submit your application, you may have more providers in your network than you do at this time. Agencies listed on the notification of interest are not contractually bound to work together. If a provider decides that they do not want to participate in your BHCC, that is okay. You would just remove them in your application submission or after. That is absolutely fine.
That means as a lead agency, if you don't have confirmation from all the agencies that you want to work with, we encourage you to still list them on the form. You're not committing them to the BHCC. Really what we're trying to get an idea of is how much of the region is covered, how you anticipate you want to, how you anticipate when you apply who you would want to work with. So also important is that if the lead agency decides they do not want to move forward and apply to be a BHCC, that is okay too. You will not be penalized by us here at the state. So how do you submit? First, you want to engage the partners in your service area. Find out who you have to work with, who the right partners would be. Come up with an idea about forming that BHCC, and then you want to describe those network providers in the BHCC member submission template. Then you're going to complete that notification of interest form and submit it to the Pick'em mailbox at Oasis and the Vbp Readiness mailbox at OMH, listed right there on the screen. It's also on the notification of interest for your convenience. So what happens after you submit that notification of interest? You'll be receiving outreach from the state, and we'll be talking to you about what other providers you may want to outreach. And as a next step, you'll be submitting your application if you feel that you're going to move forward as a BHCC and apply. So when will that be due? We don't have an exact date as of yet. It will be the end of summer. The application will be available to you hopefully shortly. So what do you have to do to submit that application? You're going to continue to engage a network, your network and affiliated providers, and report them in the BHCC member submission template. You're going to collect letters of intent from those providers,
and they must be signed by a binding authority for the application, so that is either the CEO or the board of directors where appropriate. You're going to create a preliminary mission and vision statement for your BHCC, and you're going to develop a budget and justification on how you're going to spend planning funds. So you don't have to know how you're going to spend every dollar you would receive under this program, but you do have to be able to communicate to us how you're going to spend those planning funds to move forward and develop your BHCC and move towards that value-based payment arrangement with the payer. So that is all we have for our PowerPoint presentation. Another tool that's going to be available, before we move to questions, I'm going to let you know that there's another tool that's going to be available to providers to help them determine what the appropriate network providers are to work with. Our Psyches system is going to be loading a template that allows providers who have access to Psyches to view other providers in your region that are touching these same Medicaid managed care members. So you'll be able to go in as your organization and see, I've served the same members as these 10, 20, 30, 50 other programs, and that maybe these are the programs I should be working with because we're serving the same population and we're going to be achieving outcomes with that same population. So that'll be available in June, early June, to providers. So, Boris, I don't know if you want to chime back in, but I think we can move on to questions from the participants.
Excellent, yep. So thank you for the presentation, excuse me, and yes, we have been getting a number of questions, and I think we'll move towards our Q&A portion here. So let's get that going. All right, so our first question. We are an organization with multiple area offices that cover counties in 2 planning regions. May we create a multi-region collaborative?
This is Gary Weisskopf. Is the question, is that okay? Because if that's the question, then the answer is yes.
Okay. So just to clarify, but that one organization itself is not a multi-region collaborative. They could be in multi-region.
Yes, I understood it to mean they were working with partners that cover across multiple regions, as opposed to a single provider that covers multiple regions. A single provider is not acceptable. A collaboration of providers that cover the full gamut of services across the RPC regions, that's fine.
Excellent, thank you. Next question. When you say BHHCBS designated provider, does this include bridges to health providers or only OMH or OASIS BHHCBS providers?
I believe not. It's adult behavioral health HCBS. I don't believe Bridges to Health is adult behavioral health HCBS. It would be
the HARP behavioral health HCBS service provider. Although, you know, if somebody has another question about it, we'd be happy to look at what they're proposing. They clearly have to be Medicaid reimbursable, and if they're not Medicaid reimbursable, it's not acceptable. But if there's something else besides the HCBS services that are available through the HARP, I think we'd like a question about it, and we can discuss it.
Okay, thank you. Next question, is it possible to submit the NOI without all of the providers in our BHCC?
Yes, absolutely. We anticipate that the BHCCs are going to grow over time, that you'll be adding new providers as we move to the application phase, and even afterwards. That's completely acceptable. What we ask is that you have at least some providers that you're already working with, that it's not a single agency applying.
Perfect, thank you. Next question, can organization be in more than one NOI?
Yeah, so if a provider is serving multiple regions and multiple BHCCs apply from those regions, it's totally understandable that they would join multiple regions. They just won't be a lead agency in multiple BHCC because that's a big job, and they really should be focused on the region that they're serving.
Yeah, and the issue really is, so if you're in New York City and you're in the Hudson Valley and you apply for a BHCC in New York City and you apply with a BHCC in the Hudson Valley, that should not be a problem. If you apply for two within the same region, that would be a concern, I think, because you're going to be entering into a ultimately contractual relationship for value-based reimbursement, and you have to handle the different outcome indicators. But if somebody disagrees with us and, again, wants to submit something to explain why they think a proposal to be in the same region would make sense, we'd be open to the comment. Again, we haven't finalized the application, so we're interested in people's thoughts.
Gotcha. All right, thank you. Next question. For the number of Medicaid managed care enrollees, is it the agency-wide or just in our Article 31 clinic?
That's a good question. It's a really good question. I mean, I think we were...
Of BHCC.
Well, we were thinking that it's the behavioral health population. If you did developmental disabilities or something, we wouldn't be including that in our analysis, but I'm not sure what else this questioner has in mind outside of behavioral health. It's not primary care population. We're really looking at behavioral health.
Right, but it would, just to clarify, but it would include clearly substance use disorder programs.
Yeah, if you operated a PROS or,
right.
Then absolutely it would be included in your number of enrollees.
The Article 32 programs, Article 31 programs, HCBS programs.
Got it. Okay. There's a request to provide a timeline or description of kind of the approval award process. I don't know if that's doable at this point, or is that for a different webinar?
Well, we can talk generally. The application is going to be released so that you can start working on it probably in like a month, in June. I can say June. Yeah, we can say June. We're thinking it will be due at the end of summer. At that time, the state will review all of your submissions, and after a few weeks of deliberation, we will contact the BHCCs that will be moving forward and enrolled in the program. Then we'll provide that list to the participating MCOs, and you'll be able to receive your first payment for the planning funds.
We should just really state clearly, the state will select who participates in the program, but the program gets managed by the managed care plans, and they must approve all the deliverables as satisfactory before the money can be released.
Okay, great, thank you. Next question. Must an NOI be submitted to both OASIS and OMH or either?
Did we run out of questions?
What?
Yes,
okay.
Yeah. Did you hear the question?
No.
Sorry. The question was, does the NOI be submitted to both OASIS and OMH or either?
You keep breaking up.
You're breaking up.
We're barely hearing anything at all.
All right.
Are we able to?
Is this better?
Yeah. Oh, yeah.
Hello? Okay. Sorry about that, everybody. The question was, must the NOI be submitted to both OASIS and OMH or either?
Either is fine. We're asking you to submit to both, but if it only goes to one agency, it's totally fine. We'll both be able to review it. We're going to be sharing those documents between the two agencies. This is a collaboration between OMH and OASIS.
Okay, great, thank you. Next question, can a county human service department be the lead?
That question is a challenging question for a variety of reasons. The county may or may not be in a position where every contract that it signs has to go to the county legislature. They may or may not be able to enter into a group collective contract. It's not a clear-cut answer. It really depends upon the county's own rules and whether they can participate with the flexibility that may be required with regard to both entering into contracts, but also value-based arrangements that might include both not just upside risk, but downside risk, and can the county be in a position to be able to take on those arrangements? And, you know, I don't think we can answer that. The county's going to have to talk to its own council and decide whether or not they're going to be able to do it. And the second thing to consider is that if a situation puts the county in a conflict of interest situation where they are partnering contractually with one group of providers in the community but not other providers, and they still have an oversight role over all providers, it could create just a complex situation within the community, and they're going to have to figure out, you know, how well that works in their own area.
It'll be different in different places.
And different in different places.
Some places that might make a lot of sense, actually, but some places it might be really
There might be the county and one or two other providers in a community, and that might not be an issue.
Right.
One of the issues sometimes with county government is they're not able to always release funds when they receive them for other budgetary reasons.
So I think the providers need to get together with the county and make a decision. The state is not making that decision.
Okay, thank you. Next question. How do we find out what the BHCCs that have formed in New York City are? And I guess we can just say throughout the state are.
So there aren't any at this point. There may be groups of providers that have come together in arrangements that could include an IPA, but nobody has been designated as a BHCC as of this point.
Okay. Is there in the future any thought on is that going to be available? Because there's another similar question to that.
So if the question is before we select BHCCs, probably not. After we select them, I would imagine it's public because they're getting public funds.
Are we going to be able to post a list of people that sent in notifications of interest so other providers in the community might choose to contact them?
It's a good question. We'll have to talk about it.
Okay, thank you. Next question. If we are in the final stages of developing an IPA and will be operational before the application due date, can we apply for planning funds? If not, can you speak to the implementation funds for brand new IPA?
Can you repeat the question?
So I guess the question is, it's a new IPA. They're going to be operational before the due date, and are they going to be still eligible for planning funds? If not, can you talk a little bit about the implementation funds?
Okay, so yes, they would be eligible for planning funds assuming they're selected. So one thing that's important to understand is not everybody who applies is guaranteed to get selected. So assuming that the group gets selected and designated a BHCC, they could get the planning funds.
Got it. Thank you. I guess a couple of questions in regards to, are there regional...
Sorry, one more thing. It can't be, it cannot be used for previous expenses.
Okay, so going forward expenses.
Yeah, yes.
Okay. Great. So the next, we have a number of questions about kind of regions, RPCs versus counties, contingent. Is there any, so I'm going to just try to summarize all of them. Are there any rules about regional groups, or is this just up to the providers to decide what's the region, and who joins? Or are there, do they have to stay within RPC regions or some other regions?
It is up to the providers to decide. What you should be doing when you form a BHCC is looking at the natural service areas that have the same shared lives. If you're all serving the same group of people, that is a natural region. That's how you should be coming together as a BHCC. Sometimes that'll cross regions. Sometimes that'll only cover a portion of a region. But that's how you should consider forming your BHCC.
A little addition to that is it may not be that you're just serving the same people on the behavioral health side, but they get their physical health at the same hospitals or the same primary care. So taking a look at where you overlap in order to strengthen whatever your value or proposal is to either the hospital system, the managed care plan, or primary care practice, you want to be able to pool your resources, and also from a quality perspective that you're going to agree to the same quality indicators from a contractual perspective and things like that. But we're only using the RPC regions as a starting point for planning and for programming funding. But if it turns out that, hypothetically, let's throw this out, in the North Country, they're across 2 RPC regions, and it makes sense from a service delivery point of view and either shared population, or you share it with the hospital systems or the primary care practice, then that makes sense. But there should be a logic behind it.
Got it. Okay. Thank you. So another question here. There's a couple of questions back to breaking up again. Sorry, I don't know what's going on.
You're still breaking up.
All right. Let's see if I can make this work better.
Oh, almost back.
Almost back?
No. Nope.
Oh my God. Okay.
Do you want to just show the questions on the screen?
Sure. And also, Caitlin, are you on the phone? I don't know if Caitlin can hear me.
Oh, now we can hear you. Do you want to just show the questions on the screen?
Yeah, let me see if I can do that. That's probably a good idea. I'm also having somebody else log in to make it, let's see here. All right, let's see if that worked. Folks can't see my...
We're not seeing anything. Yep. Maybe you should
You're not
keep trying
seeing
to read
anything.
them.
There we are. Oh. No, we can't see the chat box.
Type them into the...
No?
Why are we...
There we go. There we are.
All right, can you hear me? Can you see it?
Oh. We can hear you, and we can see the chat box, if that helps.
Okay. Yeah.
You can scroll
so
up.
we're getting them from the chat box, so if that helps.
All right.
Okay, where were you?
What, you want to just keep going, and we'll try and find out where you are in the chat box.
Okay. Well, I had to jump around a little bit because there were some similar questions. So can a hospital-owned outpatient clinic participate?
As an affiliate, they can participate, but not as a lead or a network provider. And in fact, we think that there's a strength to partnering with the hospitals in the area. And one example that we've given before is to think about that this money is really for infrastructure development to help providers participate in value-based arrangements. And if there's a large hospital system or large primary care practice that has invested in some sort of an IT communication infrastructure, electronic medical record, or notification system, and the group of behavioral health providers wants to link in or tie in their systems to that, this money might be useful to allow them to invest to be part of whatever that larger regional network is. So we're not trying to build these in isolation from the other parts of the healthcare system, but in fact the money is designed to help with a connection to those other parts of the system to be able to do the analysis and share information. So having a partner that would be a community clinic or a hospital, the whole hospital system, would strengthen the application.
Excellent. Okay. Can a lead agency be a children HCBS provider?
I just read them off.
I think.
Okay.
Yeah.
So another question is, how does a small network provider engage with a lead agency?
So I guess there are two ways, and others should just jump in. I mean, one would be, just start talking to them, and the ones in your area, call them up, make an appointment, or meet them through some networking event that's happening in your community. And Bacc is going to be doing several around the state, across the state, to allow a forum for providers to come together. But the other is, then we were just sort of talking about this a little bit, is that through Psyches in the next few weeks, there will be an opportunity to look at your own crossover providers. Where are the people that I serve going for hospital care, emergency room, laboratory, primary care, and it'll list the numbers of encounters, the numbers of people, and the specific providers that people are getting care over the last year, year and a half. So that will be an indicator of who you might want to talk to. But again, the RPCs, events, the networking events that are going on in your community, psyches, and calling.
And I would also suggest that at least in some areas of the state, talk to your county people and maybe also the trade associations. They sometimes have an idea of who's planning on participating, and they can who you might.
Networking.
So with regard to the RPCs, several of them have brought together opportunities for providers to come together and talk to each other. They're not going to endorse any BHCCs, but they do provide forums for people to have conversations and understand what the other providers do in the region. So it's just another vehicle for making connections.
You know, and if you really want to just take a shot in the dark, you know, call the larger agencies in your area, see if they're doing it.
Right.
Some folks have told us that they've connected with the other providers in the health home that they're part of, or that they participate in district meetings and they've met and they start to network that way. But you have to actually start connecting, calling, email, attend meetings, talk to people.
All right, another question. Regarding expenses to be allocated, if there are development costs associated with drafting the application, can they be paid for using BHCC award funds? No, the submission of the application cannot be paid for using the planning funds or the implementation funds. However, the biggest piece of what you're going to be submitting as becoming a BHCC is going to happen after the application. There are going to be deliverables. You're going to have to submit plans for how you're going to form this BHCC, what kind of quality measures you're going to be using, how you're going to report, how you're going to connect to IT. All of those things can be paid for with the planning funds. So the hard part is not the application. It's what comes after that you can spend those planning dollars on. All right, let's see what else we have.
So, and one thing just to highlight is that we're at this point, the notification of interest, we are not asking you to know what your budget's going to be. At this point, we really want an idea of who you want to work with and who the lead agencies are, what your lead agencies are interested in.
Yeah, once we release the application, we'll be able to tell you what amount of money will be available for planning, and the budget that's requested as part of the application is how you're going to spend those planning dollars. So you will have a target dollar amount that you will be applying for planning.
And there will be a requirement that the agencies are going to need to spend some of their leadership time pulling this together that won't be reimbursable by the grants that are going to be given out. So this is a commitment of time and energy on the part of the people who work in these different organizations. Can't just be, hired out. This money is really to provide technical assistance, consulting, IT, those kinds of things.
Okay, so regarding listing potential network or affiliated providers on the LOI, should the submitter have contacted potential network and affiliated members in order to list them, or is this contemplated like a matching where mutual interest is determined?
Well, go ahead. I mean, ideally, contact them.
Yeah.
You know, ideally contact them and get a letter of interest.
Right.
But in addition, we would also like to know, for the ones that you haven't managed to make contact with, what you're thinking about.
Right. So we do want letters from the CEO, right, for the notification for those that you're committed to, but it's not your comprehensive network.
If you have it, and you're able to get it, it's not required. It's going to be required for the application. It's not required for the NOI.
Got it.
Right. If you know about them and you've had relationships with them and you're really committed, we would like to get those letters, but it's not a requirement that would disqualify in the notification stage.
Right. Will be a requirement in the application.
Yes.
So you have to certainly think about that.
Right.
As you move along.
Right. If you put down 100 providers that don't know that they've been put down, and then you go to try to do the application and, you know, none of them are interested or they've gone with another group, it's going to put your application in a bad situation.
Right. So if an IPA is a lead agency, is it necessary to have an existing VBP contract?
Not a VBP contract, but you're going to need to have, the IPA will need to have a contract with the managed care plan, probably that addresses the movement of the funds. So they may need to, if they don't have a contract, and we know that a lot of them don't, they would need to contract specifically for that purpose.
Can an IPA apply if many of the members provide behavioral health services? So not all, I guess is what they're saying.
But the money has to go to the behavioral health providers. So I guess we'd have to take a look at that, who else is in the IPA, but the money is restricted to 31, Article 31, 32, and behavioral health HCBS Medicaid providers. Community-based non-hospital, just to be specific.
Will payment for the services under the VBP model be determined by the agency's performance, making this question around, or by the performance of all the providers in the BHCC?
So I think the question has to do not with this grant program, but with the contract terms that are negotiated under a VBP arrangement, which without seeing the contract, it's really hard to answer, but in general, it's applied to all of the providers that have something to do with the population covered by the VBP arrangement. So potentially, it could be a portion of the providers if you cross a large service area and you have a contract with a managed care plan that only covers part of that service area that the BHCC covers, then it may only affect some of the providers that are in your BHCC because of the geographic limitations of the managed care company or the hospital system. So it's really going to depend upon who you're contracting with, what their span geographically would be, and whether it would affect all the providers in your network.
If we have a few large providers in a BHCC, will we be required to include small providers in the BHCC?
Certainly peer agencies, and we're going to be looking at what the region has in terms of options. So if you're in an area where there are only a few large providers, then that might be okay. If you're in an area where there are a lot of providers and you're not including them, that might really hurt your application because we're trying to give a range of providers an opportunity to be able to participate and get ready for value-based, and we want to fund an arrangement that's going to give, again, we have a limited amount of money, and we want to fund arrangements that help a larger array of providers get access to VBP contracts and prepare for it.
Can an OASIS provider who is not licensed but provides prevention or other OASIS services be the lead?
They Medicaid reimbursable.
It depends on if you're Medicaid reimbursable, and that's something that we haven't had that situation brought up yet, and I can bring that back, and then hopefully we can respond to that on the FAQs.
One thing is, could they have to be Medicaid reimbursable?
If only go-forward expenses can be included in a planning budget, what is the start date being used to define go-forward?
Well, I don't have an exact date, but it would be after the award.
Yeah, once you were enrolled in the program would be the start date. Do you anticipate any situations where DOH, OMH, and OASIS will work with applicants to reorganize in a way to enable the most comprehensive network possible?
Well, once we get the notifications of interest, we will take a look at it, and we will be reaching out to providers, particularly in areas where we might have a lot of small applications that don't look like they're viable going forward, and try to see if we can help make something that's sustainable. But ultimately, it's up to the providers to decide whether they want to apply for this money or not. And for some providers, they may make the business decision that it's not worth it, that their market is very small amount of Medicaid and they don't want to make the changes. And for others, they'll say, yeah, this makes a lot of sense to us.
Is there an optimal size for a BHCC, or is there a minimum threshold size?
No. There's no empirical way to calculate it. It's going to depend on the region that you're serving. It's going to depend upon, what your proposal is. You're going to really have to think about, how do I make myself viable going forward? This is a time-limited amount of money, and when you put together your BHCC, the concept of long-term sustainability needs to be on the table for yourself, because if you can't sustain it, if it doesn't look sustainable, it's gonna be hard for you to keep it going.
I think that it's more of a question of saturation, so that you want to make sure that your group has a large enough saturation of Medicaid managed care recipients that are receiving behavioral health services to get some attention.
If you're too small, no one's going to want to negotiate a value-based arrangement with someone with 100 covered lives across 10 counties, right? I mean, just as an extreme example. But if you can bring to the table that we have 4,000 lives covered by this primary care practice, people are going to be a lot more interested, or 5,000 lives and we account for people who use significant physical health inpatient or mental health and substance use services. It's going to be a lot more attractive, but there is no absolute answer on size.
Given that the funds cannot be used for past expenditures, does that mean that network providers should hold off on new commitments and improvements, like HIT data analytics, HR services quality improvement, because waiting is as risky as investing?
Well, that's your own choice. The state's not going to give an answer on whether it makes sense to do for your own situation. Everyone's different.
Now, as a reminder, this funding, it's to help providers, but the system is moving towards VBP either way.
Right.
This is not a program that's starting to, institute VBP. The VBP is here. This is just to help, the investment is tremendous in these systems. It's going to be far beyond what you're going to receive under this program. So if you're starting to invest, that's great. If you don't have the money to invest, this program can help you, but waiting to invest, it's up to you. Is there any guidance around what types of services the lead agency can contract with an affiliated provider to provide? You mentioned IT data management, but it can be anything. Can it be anything related to the project?
It can be anything as long as it's work. If it's work for hire and there's a product that the group requests and wants to pay for and negotiates the price, it doesn't matter who delivers it, so long as it's one of the allowable elements of the funding.
Can a Ccbhc be the lead agency?
There's no reason that they couldn't be the lead agency unless they're not they don't have a managed care contract for some reason, right?
We might want to spell out what Ccbhc stands for. I think that was also an earlier question, so it's a good opportunity. Ccbhc is a Certified Community Behavioral Health Clinic.
There's only 13, I think, around the state. They're part of a 2-year federal demonstration project to create these entities that they're already existing providers of mental health and substance use services, and there are a number of requirements around them. If they're licensed and they have the managed care contract, then there would be nothing to stop them
I just wanted, I'm noticing there's a number of questions in terms of what can be spent and what people can use the funds for. I think the overall arching concept is that these funds are intended to create your BHCC and help you communicate and integrate care. And if the expenses are around those things, then it's more likely to be a part of the project. But again, we cannot pay for things that have already been spent.
And there'll be more information in the application.
All right, this is a long one, but I think it's important. We're a medium-sized agency with a clinic, care management program, pros, HCBS, and home care, but totally surrounded by counties with county-operated clinics. If we partnered with other not-for-profits, housing, vocational, in ours and neighboring counties, would we be too small to be a viable BHCC, or should we go outside of our area and partner with agencies with which we do not share clients and are not part of the natural service area?
I think everyone needs to start and take a look at their own service area. I don't think we can answer this question on the phone.
Yeah, every region is going to be different.
Right.
You have to,
county.
Yes.
And those county-operated clinics can be part of your network.
Right.
Mm-hmm. And part of the process of the notification of interest is to actually inform us of what groups are already together, how do you see your community and the people that you serve, and which providers make good partnerships for these BHCCs.
Can an already formed IPA apply for implementation funds in year one? Yes.
Yes.
Absolutely you can. The step that you have to take to receive implementation funds is to create plans. It's to use those planning dollars, or if you've already spent money on these things, create plans to implement your BHCC. So it's going to be, do you have a network plan? Do you have an IT plan? Do you have a clinical integration plan? Do you have a budget? Do you know how you're going to bring in more members? All of that, is there a governance structure? All of those things, just writing out those plans is that first step to getting those implementation funds. So if you can do that in year one, and we expect many IPAs that are already in existence will be able to do so, then you will receive those implementation funds in year one.
Right, but the amount of the money that's available is dependent upon how many of these we award, and we only have $20 million in a year. So an IPA that's further along and wants to get a lot of deliverables in may still not get as much money as they would like in any one year, assuming they're selected, because, again, there's only $20 million in the year, and we have to really stretch this $20 million over each year for 3 years, and it may not be till next year that they get the funding that they're looking for. So we can only spend what we have.
I just wanted to respond to an earlier question around OASIS prevention providers. They cannot be a lead agency, so the answer is no, because the agency needs to bill to Medicaid.
So what will the selection criteria include for the application?
When we get the application.
All right, yeah, that'll be shared with the application shortly.
Yeah.
We've got 2 minutes left. Let's see if there's any other frequently asked questions here.
Can you hear me now, guys? This is Boris.
Yes, we can hear you, Boris.
Yeah, no, it's interesting because some participants said that they could hear me. I think we were having, I guess, technical glitch. So yes, thank you for mentioning that it's 2 minutes left. I suggest maybe another question or two, and then we can close off.
You have one in mind, Boris?
I think there's a number of questions that keep asking to repeat, again, that agencies could be part of multiple BHCCs. Sometimes they could be the lead and a network another one. I mean, we keep getting some of those ongoing, so I think it's just good to repeat that. I think folks are, just...
And one other thing that bears mentioning, we will be posting a frequently asked questions document that we will be updating periodically. We hope it will be very soon. And after this call, we really encourage you to contact us via the Pick a Mailbox and the VBP Readiness email. We want to help people, and when we have frequently asked questions, it tells us that we need to come back to you with a clear answer to the group.
Excellent. All right. I think with a minute left or so, we probably should close off right now. I just want to say thank you to all of our state partners for participating and providing us with the information and answering at least some of the questions. I know we got a number of pages of questions here. And as I said before, we are definitely have recorded this presentation. We'll be posting it, including the PowerPoint presentation itself, and we'll be sharing all the questions with the state, and hopefully that will add to the frequently asked questions portion of that document. So again, just want to say thank you to everybody who joined us and for our panelists for presenting, and I hope everybody has a great rest of the day. Thank you, everybody.
And thank you to the Bacc team for getting this webinar up and running so quickly. We appreciate it.
Thank you. Take care.